Okay, great. I see we already have someone at the mic.
Hi, I'll be short. Miriam Cooperman from UCSF, and really, I just want to congratulate both of you. This is really incredibly well-designed research to really answer the questions, and we really need more of this. So thank you both for your presentations.
Thank you. Yes.
Fleischman, New York. One question for each of the speakers, very quick. Sheila, are you differentiating a desire to be informed from a desire to give permission?
Trying to differentiate whether they would require written consent, so a formal consent, or whether some other type of information would be sufficient. And the idea would be in the construct of a learning health system where patients would be informed coming in about the general nature about those things.
Okay, because your questions didn't seem to go there. And Scott, I was, as a health administrator, there are some economic implications of changing the length of dialysis, particularly increasing it. And I wondered if you've done the exercise of figuring out, would there be a need for another nursing shift? Would you decrease the throughput? Would you increase the throughput? And how that might impact on the nephrologist's views of all of this, but they might not think it was politically correct to answer the questions that way, because it might impact on their bottom line.
Yeah, I think that's a good point. We didn't explicitly seek to evaluate that sort of underlying sort of cost implication or throughput implication to this. So I'm not sure I can speak to the extent to which that might be an underlying concern, particularly for nephrologists who might have a stake in their dialysis facility. Having said that, I can at least say that no one raised that as in admittedly in a non-prompted fashion.
Just one quick comment there. In the next phase, you may, I'm a big fan of conjoint analysis. I didn't know much about it till a couple of years ago. But when you force people to make a number of choices, things that they wouldn't say often come out in the choices they make. So I hope you'll get a view of that in this next phase.
Yeah, it's always a challenge, in picking the specific attributes that you include, because the number of plausible scenarios, of course, increases exponentially pretty quickly, and then you wind up with respondent fatigue. But there are ways around that.
Great. Yes.
Tyson, UT Houston, those are just terrific presentations. Thank you for doing that. I would urge all of us in this room to consider doing the same kind of research for urgent and emergent therapies, where it's been particularly difficult to, despite the possibility of emergency exemptions, to get IRBs and regulators allow us to do research that's really critical for improving patient care. Thank you.
Yeah, I'll second that as someone who grew up doing heart attack research. We had always had a lot of questions about what it meant to enter someone in a randomized trial when they're having 10 out of 10 chest pain and with a 20% chance of dying in the next 2 days.
Sign here or else, right?
Yeah.
Carl Danjo from Rochester. Those were great presentations. Thanks. I was struck, Scott, by something that you mentioned and other people mentioned last night, is that many of these decisions about participating in research and having autonomy restricted in research are driven by altruism. And that's a word that hasn't come up much in the last day or so, and maybe something that's worth further exploring, whether some of the choices we make about how we regulate research actually restrict people's ability to act in an altruistic manner.
Yeah, I think it's a great point. The only comment I'll make is certainly we're not the first group to unearth this as an underlying motivation in driving patients to participate in research. In fact, there have even been studies suggesting that patients who choose not to participate in research harbor some underlying guilt about not contributing to that, but they have other reasons not to participate.
Great. I mean, my final comment would be, you can see these are work in progress, but they are sort of knitted together to give a composite picture, and I hope the digestion of all the information that's about to come out from these surveys and studies will be relatively public exercise, because the raw data, I think, is going to be fascinating. I think we've already seen yesterday the interpretation might be different depending on the perspective you come in with. So thanks.
Great. Thank you.